Hey, good afternoon. It's time for the Big Brain Radio Show on TV. I'm Dr. David Susi, and you can call me Dr. D. And today we have a special guest, Dr. Adam Klotzig.
Thank you.
Dr. Klotzig has been my partner for what?
Gosh, it's been 9 years now.
And the reason I have him as my partner is because he knows more about the brain than I'm sure 99.9% of the population.
Thank you.
And I would consider him a world expert on the brain. He lectures all over the world. He's been in Brazil lately, in Europe.
Brazil, Spain, London, throughout the United States. So I've been traveling quite a bit these past couple months.
And I would consider him a top expert on concussions. And so it's always fun to have him around because I ask a question and then he just spills the knowledge and we can,
well, we make a good team.
Yeah, we make a really
very good team.
So, so should we call you Dr. K?
I think you should call me Dr. K.
Now, the Big Brain Radio Show, for those that have not seen us before, the Big Brain Radio Show is a TV that I had on radio, obviously. And we had it for 10 years, and we still do it on 9:50 a.m. But what we really want to do is move into the area of TV because I think there's more attempt for people to learn what we have to say. And the concept of the big brain is that we all live in our brain. We know no other thing about life other than what we experience in our brain. I know that's a little hard sometimes for people to grasp, but stop to think. If you're not aware of it, it is not happening.
That's true. 100% true.
And all our experiences decide who we are inside of our brain. No one has ever stood outside themselves and looked at themselves using their brain, because we don't. That means that you really are the center of your own life. And that's a fantastic opportunity for us to understand how great our brain is. It is the big brain. It allows us to have a life that continues to develop and that we actually create life as we move through life and times. And we deal with it mostly in health.
It's interesting.
Because the brain controls 99.9% of all our functions. There isn't anything that happens in your body that the brain doesn't either regulate, you're the expert, and to change and modify.
Well, that's true. I mean, from a feeling standpoint, every part of your body has a little piece of real estate located in your brain.
You want to explain that a little bit further?
That basically represents that body part. And that's ultimately where you feel. So a lot of people get confused because if they feel something in their hand or they feel something in their foot, they automatically think that it's coming from that area. But realistically, it's all being generated by your brain.
That's right.
Yeah.
So what you visually see might stimulate another area that has to do with your foot, and you'll feel something with your foot because the complexity of how we are developed is majestic in itself, and we continue to adapt and develop our own being. And the thing that we develop is our knowledge, our ability to get information and continue to use that information through our life, remember it and use it. And then we have an aspect of ourselves that understands what this knowledge is and how it applies to life. So it's seeing life in general, the big picture. And that is where you use your ability to understand, compare and contrast, where something is insinuated, all the little subtleties, and then to know what things are going on that are different than you have expected and what things are normal and how you can kind of put it together. We call it the big picture. Did I get that right?
I think you did a great job with that.
I'm going to keep asking you.
That was really good.
Okay. And it's actually the way that we develop as children. When we're born, well, actually when we're conceived, that's gravity attracting two cells. Mm-hmm. And gravity continues to cause us, it is the only physical constant in our life. So you want to explain why that's the truth?
Well, basically, from a developmental standpoint, if you look at how your brain is wired, it needs stimulation to work. And
to grow.
Then to grow and to develop new connections and all those things. And the constant stimulation that exists on this planet is gravity. So the brain has utilized gravity as a way to provide for constant stimulation. So, we know about astronauts who spend time in outer space, and when they're out of the Earth's gravitational field, they start to develop quite a few neurological issues, cognitive issues, behavioral changes. Some of them are blind for a little bit, nausea. So we know that there's a huge interdependence there.
Right, and the gravity is also important. We have a genetic code that's built into us when we're born. And that code is it only shows up or that level when you reach the age that it's appropriate. And it reaches that age because we're bigger and we have more stimulation rated to gravity, and now we're going to have a 5-year-old brain. You don't want a 5-year-old to have a 10-year-old brain. You want to have them to have a 5-year-old brain.
Though many do.
Parts of them. So as we get older, we're genetically going to express ourselves. We think it's our,
Right.
and we as individuals think it's us, but it's all been wired in ahead of time. And then your genetic code and your experiences in life and how you see them and use them and what you're exposed to is going to create you. And that's your life. So you want to understand the majesty of it all and how unique it is. And we use this in the health field we can help people understand what's going on with them when this whole process is interrupted. We were trained originally as chiropractors, so the spine is the main conduit to the brain. So treating the spine obviously is going to get some results and change things in the brain and create health.
Yeah.
But the biggest thing that we, in the last 15 years and 10 years, which is why I had Dr. Klotzig come up from South Carolina.
Yeah, well, it was nice and warm.
I told him that the snow wasn't a big deal, and when he was driving up here.
I was driving up in a blizzard. And I'm originally from Canada, so I'm used to blizzards, but I hadn't been in a blizzard in like 15, 20 years of my life, and I'm coming up here and I'm going, what have I gotten myself into? You know, there's snow everywhere, but it's been worthwhile. It's been a great experience.
Yes,
to be
and
here.
so
Thank you.
And so we have a clinic, Kenwood Concussion and Chiropractic Center, but we really have started focusing on concussions because that's the ultimate problem where the brain gets interfered with their health.
True. And what we've kind of learned, we can learn a lot just by studying what happens to people who've had concussions. So a lot of the symptoms that people complain of when they've had a concussion, and it's due to damage in the brain, or headaches, they can complain of nausea, they can become depressed, anxiety, vertigo, dizziness, neck pain, back
Fogginess,
pain. Yeah.
Personality changes.
Yeah. And so the thing for us as clinicians, when we have someone who comes into our office and complains of that type of complaint, we see a relationship to it being generated because of damage or problems in the brain.
Yeah,
and that's what we're learning in concussion. It's very exciting.
We have two kind of arenas there. We get athletes coming in with concussions. It's obvious, you know, they're professional athletes and haven't really restored. Supposedly they're over the concussion, but they really haven't gotten their function back. So we've learned from helping them, and then we notice that regular people come in and have the same problems. So they probably sustained a concussion, which is why they're not getting better.
Yeah, and no one's been treating it, or it's been treated inappropriately. We'll talk more about that.
So what we're saying is if you have a chronic problem, an unresolved problem, it's getting so good. And here's what I don't want people to get stuck with is, I'm good, it's as good as I can get. That's probably not true.
Yeah.
It can get better. And we see it all the time. We had a marvelous story today that I will relate later.
Yeah.
So welcome to the Big Brain Radio Show on TV. And welcome to Dr. Klotzig. Yeah. It's his first here, and I'm sure he'll be a lot more.
I'm looking forward to it.
Yeah, I am looking forward to it also. So thank you for listening, and we're going to be talking more about concussions in the future. Thank you. Welcome back to the Big Brain Radio Show on TV. I'm with Dr. Adam Klotzig. First of all, I should say I'm Dr. David Stussy, and you can call me Dr. D. Dr. Adam Klotzig is a world expert on the brain, and he's my partner for 9 or 10 years. And we have a lot of fun in the way we get people healthy as we treat their spine, but mainly we get their brains to start working in a way that is more effective. Most of us don't realize that we live our life in our brain. It's the only thing that we have that controls and contributes and sort of modulates. You get to be the director and the producer and the actor all at once.
It's the master controller.
It's a master it. You are it. Putting on a one-man show or one-woman show or one-person show.
Didn't you used to say it's the ultimate virtual reality
It is
machine?
it is the ultimate virtual reality show.
Yeah.
So welcome to our virtual reality show.
Well, thank you. So we're going to be talking about concussions, right?
Yeah. So what I wanted, we have mentioned on previous shows, we've talked about concussions, but I wanted from Dr. Klotzig's point of view, what is a concussion and why does it cause the problems it does, and why is it not really being evaluated correctly when people are told that they're better and they're really not?
So
that's enough, isn't it?
That's a lot, a lot to talk about. So let's just start. What is a concussion? pretty well anything that causes damage to the brain can be considered a concussion. Most commonly, it's seen with some type of blow to the head, such as a fall, or you're playing football, you take a hit to the head, but it doesn't have to occur just because you hit your head.
Yeah, in motor vehicle accidents, just that sudden boom, boom, boom.
It can occur in motor vehicle accidents, just a sudden movement of the head, and what it does is it causes damage to the actual nerves that are interconnected within your brain. The problem is, what that damage occurs is that it's beyond the ability of MRI or CT to basically see it. So a lot of people are misinformed, because if they've had a head injury, they'll get an MRI done or a CT, and it comes back clear, and they think that they didn't get hurt or they didn't suffer a concussion. Mm-hmm. You don't need to lose consciousness, okay, to be considered having a concussion. But the more severe ones tend to be associated with loss of consciousness. So getting back to what happens to the brain, as your brain moves around inside your skull, when you hit your head, it also twists on itself. And that twisting movement causes damage to the actual axons, which are the fibers that connect the nerves together. And that damage causes a short circuit in different areas of the brain.
And isn't this more in the brain stem where it kind
Yes.
of connects more?
Yes, and it's analogous. So your brain stem is basically that piece of anatomy that connects your brain to your spinal cord.
Yes, and when a child is born, basically all he is a brain, what he or she
Brainstem,
is a brainstem, which means they have daily functions and they're able to start working heart rate and stuff, but they really haven't developed their brain, which is what's going to integrate or organize all that. So the brainstem is kind of central to our existence.
Yes, it is. And when that brainstem twists on itself, it's analogous to taking a towel that's been soaked in water and wringing it out. All the pressure that builds up on the inside part of the brainstem. And it just happens to be what lives there are all the centers that control your eye movements, all the centers that control your balance, centers that control pain modulation within the brain.
You should repeat that again.
Well,
pain modulation.
Yeah, pain modulation. So there's areas in the brainstem that block pain signals before they reach the brain for realization. Those areas get damaged, and people start feeling pain, headaches, and so on. And then the other major area that gets damaged is the very front part of your brain, your frontal lobes, and
this is where
they're really important. And that's you're an expert in frontal lobes.
This is where we live. This is where our life is created, is in our frontal lobe. We experience everything there. It allows us to be who we are and allows us to express who we are unless it's interfered with. So I had a lady this morning I was interviewing, and she'd come up to visit us from southern Minnesota, and she'd come up 3 times, and she's doing a lot better. But she was just saying, when she was this way for 2 years, she'd been to about 10 or 15 doctors.
Yeah.
And
that's usually the case for the chronic ones.
yeah, and she told me that she was actually better when she walked out of the office the first day. So what we're talking about is that we actually change things that people say can't change. And we know that because they change.
Right.
And we measure it. We're not making this up. We don't talk them into it. And she was able to actually drive and do those things. But what I was really getting at is what she explained how her personal experiences was. She wasn't able to get along with her family. She said I was mean. She said I would go to a funeral and I wouldn't even understand why I should be feeling sad.
Yeah.
And that was just the opposite of her personality.
And that's your frontal lobe.
That's your frontal lobe.
Yeah. Your ability to be able to have empathy for other people. And yeah, she felt like she just basically disconnected. Didn't feel grounded, foggy, not clear about stuff. And she's been suffering for this for 2 years. And she went to various different doctors, and they did various types of treatments that are considered common for people who've had concussions and suffer from dizziness. But they weren't working. And we feel the reason that they're not working is that the level of understanding in what's happening in the brain isn't as great as we think it is in most practitioners.
Yeah, they think it's sort of this general thing that they can just work with.
Yeah, they think they can just prescribe general eye exercises or balancing exercises, and the brain's going to rewire itself. And
plasticity just doesn't happen.
Yeah.
One thing I wanted to point out is how people might get a concussion. They don't think they're hurt, And then other conditions start coming along as these changes take place, and no one actually connects it to the actual concussion, or they don't really think it's a problem. It's like it feels, because their brain doesn't inhibit pain, they think it's a bad shoulder, when really it's, like you said, the real
Yeah, it's
thing.
really coming from the brain.
Yeah.
Right.
So if you have been in a concussion, you would be wise. We do courtesy evaluations on concussions.
Yes, we do.
And just if you say you come in and listen to the Big Brain Radio Show on TV, we'd be happy to do that.
So I guess the question would be, what do we measure to see whether people have had a concussion?
Yeah, and when we do our next session, we're going to talk about that.
We are? Okay, all right.
So I guess what I'm trying to do this is have people see that a concussion is very common. Who hasn't seen stars? You know, you hit your head, and it can change yourself. And the real problem is if you have more than one. And the younger people get them, we just went to this program by Dr. Amalu, who was the star in the show Concussion.
For the NFL, right?
Yeah,
He's
who exposed the NFL. And he says the younger the kids play, the more likely they're going to have a serious injury. And,
Actually,
and we're not here to pass judgment on that.
Actually, the seriousness of the injury is worse, and they suffer worse.
Yes.
Than
But
an
we had,
adult having
I
a
think of one
concussion.
boy we had come in, he was about 12 at the time. He had one concussion, he got another one, and he couldn't speak.
Yes, I
And
remember
he'd been
that.
all over to lots of places, and we got him speaking quite quickly, I think.
So I guess, you know, the difference that we make for people who've had concussions has to do with the patterning and how we treat people. A lot of individuals only focus on one aspect, but we incorporate a whole bunch of different treatments and incorporate them together.
Yeah, with the history comes the mystery, and the mystery is what we want to solve.
Yeah.
And we do that by testing certain areas and very nervous system. Your brain works in nanoseconds, so it's always you're always able to get a response. And all we want to do is create hope. Okay.
Okay.
And hope is all anybody wants. So once they feel this change, then they know they can get better. It changes their life because they've been kind of led down the wrong pathway very often. So if that's your case, we're here to offer you hope, and we're doing this because we love seeing people get better.
We do.
Yeah,
We do.
it's kind of fun. Anyway, it's
And
Big
we're
Brain
getting-
Radio Show. We're going to have another segment where we're going to talk about,
We're going to keep talking about concussions.
well, we're going to talk about what we do.
Okay.
So thanks for watching Big Brain Radio Show. I was going to say brainwaves to radio waves, but brainwaves to TV waves. The right waves. Hey, welcome back to the Big Brain Radio Show on TV. We've been talking about concussions, and I have with me Dr. Klotzik, Adam Klotzik, who is a world expert on the brain, and he's my partner. And we are especially world experts on concussions. And we take a very unique approach about this because we think concussions are underdiagnosed, undertreated, and are the ramifications of a lot of chronic problems people have, even leading to the things that everybody accepts as normal, like dementia and loss of other functions that really go back to these, you know, they're not major brain injuries, but they're minor, but they're enough to cause problems that don't correct them.
Yeah, I mean, you have a couple billion nerve cells in your brain, and sometimes it takes a while when they get damaged for things to start to show up.
This is really the truth.
Yeah.
People do not, they're minimized. A lot of times people are forced to go back and to work, and the doctors don't really understand the prognosis and the little signs that you need to be looking at that this patient has not gotten better or is not totally better. Okay.
So we should talk about what we do different.
Yeah. So
People would know.
yeah. So what are we looking for when we're looking for something?
Well, here's the thing. So when you get a concussion, there's a couple systems that basically get damaged. Okay, one of them is the areas that control your eye movements. That gets damaged. The other area that gets damaged are the inputs from your inner ears. Another area that gets damaged is the input from nerve endings in the neck and the spine. That gets damaged. And all that information that was once coordinated, orchestrated just beautifully to keep yourself balanced and working well gets all screwed up. Okay? And a lot of physicians only treat one area at one time. So you might go to a clinic and get some eye exercises, but no one's really going to give you anything for your neck. Or you might go to another clinic and they might only treat, the problems with the inner ear, but they don't understand the relationship of the eyes to the neck and so on.
Into the perception of balance.
Yeah, perception and balance. And I think why we are so good at treating concussions is because we understand those relationships better. And I mean better than anybody else.
Yeah, and these patterns that we have to have a pattern in order to correct that. You can't just do something and expect, you have to know, is it balance you correct first? Is it the fact that the brain, one side of the brain is not working as good as the other, do we correct that first? Is it the fact that the eyes can't really focus, and if human eyes cannot focus, you are really missing a lot of what your life is about, and all your body has to tighten up, and you can't get rid of that stiffness. There's a spatial indifference.
Right.
What's it called? I forgot the word.
It's called a sensory mismatch.
Sensory mismatch.
That people develop.
And sometimes I tell you, if you're sitting out there and you're listening, is keep your eyes open and turn your neck as far as you can. Then close your eyes and turn your neck. If it's easier when you close your eyes, you have a sensory mismatch, and you already have some of this going on for you. You don't even know it.
Yeah, and if you've had a concussion, you've gone to other places. Many of you might be familiar with just some gaze stability exercises that you do, where you look at a dot and you move your head back and forth, fixating on a dot. Problem with that is that if you do that in a scenario where you have bad input from neck nerve endings, what you're going to do is reinforce that bad pattern. And that's why people don't respond, because what they're doing, they're exercising in what we call a maladaptive state.
Right. I noticed that sometimes when they give them exercise, they just have them do it. If we did an exercise before you left, we would check to see if it actually was creating the change, or if it didn't, it tells us what to do next, because you always have to look to see what's happening. As I said before, in the history is the mystery, and we really have to find the mystery of the complicated way that your body is trying to adapt, because it will adapt, because that's what human beings do. We survive. After these injuries, everybody is falling a little bit, but they don't really know it because their body tightens up certain muscles, but they can't understand why this hip is tight all the time, even when people work on it, because your brain is using it to keep you in balance, so you're not going to fall.
Yeah, but some people won't realize it. So if you do have a tightness in your hip and you're constantly stretching it, you're constantly getting it adjusted, and it just doesn't go away, it's probably due to a secondary problem, and that's most likely in your balance, where you position yourself in space.
And it's always amazing because the brain works in nanoseconds. So if you do the right thing, you do get a change. Like we've had people, like we were talking in an earlier session, lady walks in with all this dizziness and she can't hardly move and her legs feel like lead, she said. And she left the first time with a lot of those feelings gone in an instant. I've had patients, and we've had patients that have had pain for years, and we just do a little thing and the pain goes away. Is it going to stay away? No, because there's a system that has to be organized. But we're able to show that the brain has the ability to inhibit that pain, which you were talking about earlier, these brain modulation centers.
Right, and basically, I mean, it's all about how these areas of the brain communicate with one another. And in order for a certain function to occur, what has to end up happening is you have to have certain areas of the brain come online at very specific times. So A has to fire before B, before C, before D.
Right, this timing, that's another whole area.
Yeah, and when the brain gets damaged, some centers become more unstable, and they may react a little prematurely or delayed in their reaction, and therefore the function that was associated with that doesn't take place. It
and
becomes
human beings
dysfunctional.
are very adaptive, so they actually adapt to that, but that becomes who they are, and then all of a sudden they lose track of who they used to be.
Yeah, that's true.
And then they don't even know who they used to be, because it's something that's very common as we treat people. They go, wow, I haven't felt that way in a long time. They even kind of forgot.
Yeah, and they forgot that they could actually feel that way again.
Because as humans,
They've
we
given
will
up.
adapt to survive. And
Yeah.
But we would rather have them thrive than just survive. We want them to thrive, right?
So most people, when they get injured, and if they don't do anything about it, they'll maladapt. They won't adapt in a positive way. They'll adapt in a negative way, whether they'll change the way they walk. If they're dizzy, a lot of people, well, I just won't move around as much.
Right, they stop moving.
Yeah, if you got bad knees, well, I'm going to sell the 2-story house and I'm going to buy a ranch. I'll just get rid of the stairs and things along those lines. So, and that's not the way it should be.
And so what we're saying is we really use the whole body approach, because we know that everything is going on with you at the moment you walk in, whether it was a concussion or a neck injury that caused symptoms that are like a concussion. We're going to look at the whole thing, all the areas, and people are so surprised. how everything kind of connects, things that have been happening to them. They kind of intuitively knew it, but nobody would agree or nobody was even interested. They won't listen, and so they just the fact that we listen to them and we take that into consideration.
Yeah, we had that one lady come in yesterday into the office, and this chronic left-sided neck pain and tightness and things like that. She's had it for years and years and years. She's gone to see other chiropractors, been adjusted with no avail. And we looked at her eyes, and one of the interesting findings is that if you looked at her left eye, it was really inward rotated. It was like right where her nose was. And what people don't realize is there's a relationship between that eye muscle that causes the eye to move in and also the neck musculature that's tight. So I told her, I asked her, I go, you know what, looking at this, I mean, I pretty well tell you that your left side, your neck is always more tighter. She goes, how'd you know? Well, because you see that relationship. So what we do differently now is that we see that relationship and then we treat it appropriately.
Yeah, we actually have an amazing amount of information about the brain because we're actually able to tell even how their personality is going to go.
Yeah.
We've talked about that on other
You're an
shows.
expert on that.
Yeah.
You can look at someone and go, okay, I already know that their right brain is not doing so good.
They're good at one thing and bad at another, or one side is dominating their life, and it's causing a lot of changes that they are really stressful. Anxiety sets. Most anxiety is really just a misperception of what's happening out there and what your brain thinks it is. It is not a psychological problem or a psychiatric problem.
That's a hard one to get, but
That is
you're right.
really hard to get. And even most depressions, except severe depressives that are caused by drugs or severe injury, really is just a mismatch of what you're perceiving, and so then you don't feel very good because you don't feel like doing anything.
Right.
That is all a brain function. So that's good for another show. We do that.
Yeah, we should do that one. That'd
Let's
be a
talk
very
about that.
interesting show to do for us, for sure. We could have a lot of fun with that.
Yeah.
Okay, you're on.
Anything else you want to talk about?
No, you know what? I think I just wanted to maybe bring up that last concept of the idea of hemisphericity.
Yeah.
How it's really important for both halves of your brains to be balanced.
Yes.
Okay, and to work together. And the idea of hemisphericity is basically this idea that one half of your brain underactivates over the other. And that leads to a lot of health issues.
Because one side of your body, we'll tell people to do their arms and close their eyes and put their arms and they go like this. That means that one half of their body is not connected to the other,
Exactly.
so they come up with some makeshift complications, which means they're going to have all kinds of problems. So we are available, and if you
call us
want to have a
anytime.
courtesy exam, it's the 612, I can remember this now, 374-3392, and say that you heard us on the Big Brain Radio Show on TV, and we will give you a courtesy evaluation about concussions and tell you what we need to do in order to evaluate you. There's no, there's no stress to it. Just you might want to find out how your life could work a lot better. And we have lots of stories we can tell.
We will, and we will.
And we will come back and tell you later. Thanks for listening to the Big Brain Radio Show on TV.
And thanks for having me on.
Thank you for being
Oh,
here.
thank you. Appreciate
Thanks.
it.